For the last panel today, as we have already discussed how technological innovations, artificial intelligence, and various other digital technologies can be leveraged in public health infrastructure, we'll go into more detail in our panel discussion on predicting the future impact of generative artificial intelligence, cloud computing, robotics, and next-gen technologies. For this panel, I would like to invite Praveen Bist, Chief Information Officer, Amrita Hospital. Please give him a huge round of applause. Prashant Vashisht, Chief Information Officer, Moringa Asia Healthcare. Dr. Shantanu Dhar, Senior Manager, IT, Clinical Applications, SCG Hospital. Mohit Tandon, GM IT, Sri Balaji Action Medical Institute and Action Cancer Hospital. Himanshu Bhardwaj, Head HIS and IT Applications, Medanta, the Medicity. Rupinder Singh, Chief Operating Officer, UnivLabs Technologies Private Limited. I would like to invite Nikhil Goel, Vice President and Head IT and Projects, Max Healthcare. Apologies. I request all of you to welcome our panelists with a huge round of applause here. For carrying forward this session, I would like to invite Rajneesh sir on the stage.
Nice lunch, and this is the most challenging time to keep the audience awake, and I hope the discussion will be as exciting as the ones in the morning. So from morning, we discussed from the policymaker perspective on healthcare, from a national, state level, public hospitals, private hospitals, global level. Then we discussed through two panel discussions where the top decision makers of the hospitals, the MDs or the CEOs or the COs or the medical directors gave their perspective, one on increasing the operational efficiency of a hospital, improving patient care, and what are the challenges of what we are calling a smart hospital of tomorrow. Now we have the IT experts, so the technology experts from different hospitals, and we would like to dive a little deeper into what sort of new age technologies that are happening in the hospital healthcare ecosystems. What are the impact? We would also like to talk about the security aspects, how are hospitals being made more secure from a cyber security perspective. So we have a very eminent set of panelists to do this, and I'd like to start with Praveen on when we are talking about different new gen technologies. They would span from GenAI to big data, IoT, robotics, all of the different measures. And from the morning, we have hearing about HIS. There is a recent government notification about standardization of different kind of HIS applications. EHRs or the EMRs are also becoming important. So from all these new gen technology perspective, how are Indian hospitals witnessing this deployment, and how would you measure the success of this deployment? Starting with you, Praveen.
Okay, thank you. Thank you to APAC News Network for setting up this stage and giving us this opportunity. So in terms of new technologies, yes, there is a big list, and definitely there is a lot of fluff also. Whenever we talk about AI, everybody and anybody wants to leverage it without knowing what it can possibly do. But definitely AI has a good opportunity, provided that we use it carefully. For example, we all are used to using ChatGPT for our day-to-day mundane kind of work, and we see sometimes it's very, very helpful, but at the same time it can also hallucinate, and we all probably have experienced that or at least heard of it. But when it comes to medical domain, having any slight error also is not acceptable. So we want to be extremely careful that we are using it only when it is perfected in a way, right? So that being said, we are trying to, in at least in Amrita, since we are a part of a university and we also have a big research arm, so we are practicing where instead of using Chat GPT as is, we are calling it My GPT, where we are using some open source platforms like Llama, which is from Facebook, and trying to utilize that to do a very specialized function. So we limit the data source that it has, and that way it is able to be accommodated in our own data center. So we don't have to go to the cloud. That way patients' information can be easily exchanged without having to worry about, oh, are we not following some of these data privacy rules. So with that said, I think we have to, each one of us have to figure out what works best for us, and with careful determination decide that. And in terms of, you were mentioning about the, how do you ensure that we are deriving the right value or return on investment. So in, even a single life saved or having a better patient experience, it pays for more than any investment that you can possibly do. So I think that is not a question as such, because all of us do realize, especially everybody sitting here are from technology background, and we all would appreciate that. So that being said, I think it's more about our limitation of what we think technology can do, and then putting our minds together and going to go for that solution.
Okay, so what you were saying is there is still limitation on from the hospital side in terms of what can be deployed and what are still missing in action, if I may say. Okay, Prashant, Vashisht, I'll come to you next with the same question in terms of how are you witnessing the deployment of these large new age technologies, IoT or Gen AI or even cloud deployment from a hospital perspective?
Good afternoon, all. Thank you. Well, if I see it from hospital perspective, I can see massive change in the mindset of management as well. Now people, especially management promoters, are embracing all such technologies in a wider range. I have seen practical examples, especially when you talk about clinical excellence. People are deploying AI element, people are deploying IoT kind of elements in clinical excellence, in patient care, even patient safety. It's widely used. We are using AI in various areas, like in radiology, we are using it. In other areas like service delivery platform, we are using AI. Even from patient safety perspective, IoT along with wearable devices playing vital role, and has already been accepted widely. Especially you look at group of hospitals, so there it comes in use. But having said that, it's really if you talk about measurability, it's not easy to calculate on this juncture because AI is not 100% mature. Number one, because for any new thing you need to have three elements readily available: people, process, infrastructure. So people also need to support over here. For an instance, how AI can evolve, you need functional expertise, you need subject matter experts in this area, then only it can evolve down the line. So here people are also carrying some sort of dilemma. It's double-edged sword or something like that. My job might come at stake. I mean, you talk about managerial people, mid-level management. So here people management is something which is important. All must understand it is for our benefits. Being technology evangelist, I can always favor this, but I'm taking side of operation as well. So sometimes the product is not enough mature. Sometimes all the use cases are not, added over there. And immediately somebody comes and proposes something lucrative and you immediately say, yeah, wow, what a great idea. I'm going to do this without even analyzing all the pros and cons. So this is the challenge. And when you go in the market, you every day receive new proposals and many people try to attract you. This is one initiative which can, bring efficiency, save the cost by 20-30%. But again, having said that, if all the use cases, all the pros and cons are not considered, especially if infrastructure availability is a challenge, then again a problem. If process is not streamlined, then again it's a problem. So if you see in last 4-5 years, especially after COVID times, there is significant surge in all such technologies, especially teleconsult or wearable devices. And I have seen all these applications running perfectly. But again, it will take little more time to get mature.
Okay, thank you. So you have to give time to all the technologies to mature. To only after that you can gauge their successful implementation and build really what I can call efficient use cases for that.
Yes. Use cases are essential. On top of everything, all jointly can work. People, process and infrastructure.
Okay.
Without any element, it's really not possible to rule out what you are expecting or anticipating in advance.
So the three sides of the triangle, people, process and infrastructure, that's also very critical. Okay, thanks. I'll next come to Dr. Shantanu Dhar. My question is, I'd like to speak about some of the hospital or healthcare related technologies. From the morning, we have been hearing about HIS, automation of HIS, and how digital HIS is becoming critical by integrating all the aspects or facets of a hospital operation. The importance of EMRs or the EHRs, things like wearable devices which are also coming in. So how would you assess the impact of these technologies, and what's a sort of a status update on where we stand today?
Sure. Very good afternoon to all of you. Thank you, APAC Network as well. So I think the question that you've asked, it's an entire universe of questions that you have asked me. I'll break it up into 2 or 3 pieces and try my best to answer these. First is how technology will be helpful for the hospital structure. Right now in India, we have HIS, we have EMRs, we have lab systems, we have radiology systems, we have CRMs, we have for HRs, we have human resources, we have different applications as well. Having all these is good, but integrating all these is the most important part. So if a billing is happening in HIS, it has to move to an EMR where a clinical documentation will happen by the doctors or the nursing team. Then it has to go to a doctor's portal where you can do the entire OPD advices can be generated. Now, if the patient is becoming an inpatient, then it can be the entire discharge summary should come out of the EMRs. Now, along with that, we should have the same applications integrated with the lab systems. It has to be integrated with our PAC systems as well. So where our radiologists are going ahead and seeing the images and reporting, at least the report should flow over for our physicians and consultants. In short, if I have to say in short that we have to give a one-stop shop for our physicians where they just click into one application and can see the entire patient journey. Now, the second point of the question was, how is EMR helping out in the entire gamut? I think, again, once we have done the integration, that's a very good part. We have given a one-stop shop as well to the physicians. Are the physicians adopting to that application? That's a very important part that we need to understand, all of us. We have seen that when we rolled out in ours mainly an oncology practice, when we rolled out the entire application, an integrated application, we saw that all the arms and ammunitions are there, but the adoption is not there. Then what we did was, we of course did a lot of training, hand-holding, tip sheets, video recordings, all these were done. All pan-India for all our hospitals. What we did was, after that, we started making mandatory fields for our doctors to complete the documentation. Now, we wanted the structured data. So, of course, it has to be a kind of drop-downs and not free texts. So we started giving mandatory fields. And what happened with that was that we saw in one of the drop downs, there is something called others. Now, when you click on others, there's a free text field that's opening up, and doctors immediately are writing it as a ABCD and just moving to the next slide. So even if my adoption is 60%, but actually I might have the actual data, which is the actual clinical data might only be 20%. So we started curbing those off as well. So I think one is integrating, and second is most important would be how the physicians are adopting the system are the two main key factors in today's world with respect to, at least in Indian healthcare, with respect to the application point of view.
Okay. So integration and adoption. Great. Mohit Tandon, my question is, again, since you are from a hospital specializing on cancer patients, and one important aspect is the patient data privacy. And from a patient data privacy, the data security aspect, what are the challenges that hospitals are facing, and how are you looking to meet to those challenges?
Good afternoon all. First of all, thank you APAC Network for choosing me to be on the panel today. So see what we are doing in our hospital, we are scanning all the oncology documents, and we have made a custom solution through which the doctors are just accessing the patient's data. No one knows where that actual data lies. So the entire URL is completely hidden. It's being bypassed to some other URL, and everything goes like that. And also in the back end, we have a SQL, and if you go to a table or something, the data would be in the encrypted format. So in this way, we are trying to save our data, although we have all the compliances in place, but still these days new technologies are driving through AI, and you don't know which will come and hit you. So that's the main way that using encryption, we are trying to save the data.
Okay, thank you. And thank you. That's an extremely important aspect that you are touching upon. Next, I'll come to Himanshu Bhardwaj. My question is, there are so many HIS applications available. There can be HIS applications from third-party sources. Lot of hospitals are having in-house self-developed HIS application, and we know HIS is critical to integrate all the operations of the hospital. Now, how do you standardize HIS in that overall system? And the lack of standardization, what are the problems it is causing?
Thank you so much for inviting me on this panel. Well, as far as standardization is concerned, you may say that the standardization is required or the codification is required on the services which we provide. Rather than an HIS, an hospital can follow different processes. At the end of the day, if they are NABH certified or if they are JCI certified, so more or less on the process point of view, they'll fall in line. Having said that, when you talk about the services, if you start the proper codification of the services and the codification is already available in form of SNOMED, in form of ICDs, but having said that, it's very, very difficult to make use of these codifications while at least in the OPD environment. In IPD environment, definitely you can do the mappings and all that stuff. But when a physician is, is writing a prescription in OPD environment, it's very difficult for them to go around and pick the right ICD codes and do this kind of work. So probably this needs further post facto working of codifying the data either in SNOMED or ICD depending upon the requirements, which if you see in the West today also is being done, right? So no doctor or no physician is actually focusing on looking at this codification. It is done mostly post facto by the companies who are sitting in India. I won't name them, but there are lots and lots of companies making billions out of it, just doing this kind of codification. So indeed that the process is required. Moreover, they are more prone towards only the payer processing, which means that everything is covered through the insurance. So they are focused to codify based as per their requirement. Now with the government regulations coming in, for getting the payments through the government, through their portals and all. Slowly and steadily, these codifications will come so that there is a unified picture of patient data to everyone. So yes, sooner or later, these codifications will definitely come into picture.
Okay, so waiting for those codifications to sort of standardize the overall process, if I may say. Nikhil, Goel, next. Critical patient data we talked about. The overall, the security architecture of the hospital, we know it's much highlighted, the AIMS case which happened about an year and a half back. What cyber attacks can do to a hospital, and it can, this is one segment where there is not even a scope for a 99.99% uptime. It's after all question of life and death. So how are hospitals geared up to and say protect themselves against these sort of cyber attacks? What sort of architecture would you advise?
First of all, good afternoon, everyone. Thanks for inviting me, and I would say it's great to be with fellow panelists and APAC News Network. So I think specifically if we talk about security, I would say from other industries, specifically let's say BFSI and all that. I think the adoption of security has been a bit delayed in healthcare, but it has been rapid in last few years. That has been the case. Now, when we talk about the security, security has to be ingrained at all levels. It is not that it is only at the data level. It has to be at the perimeter level, wherein your infrastructure needs to be secured from perimeters through your firewalls and the standards around your infrastructure. There needs to be the security by design in terms of, let's say, if a lot of hospitals today, as you said, are doing a lot of in-house developments in terms of their HISs or EMRs. As part of the design process, your security components have to be built in the development that you're doing. You should be having a DevSecOps processes in place. You should have static scans being done for the code that you're writing. You should be having dynamic scans, a regular vulnerability assessments, penetration test of the entire infrastructure, application landscape to the tune of the devices. Let's say, for example, many hospitals these days are using robots. We are using robotics. Even at that level also, the device level, we need to have security in place, because if you look at it from a data point of view and from a patient information point of view and health information point of view, all the application, all the interfaces, all the touch points through which a patient interact with an hospital, you are actually collecting a sensitive data, which is in the form of your identifiable information, your financial information, your credit card information, or your health information. Now this needs to be secured. And I think as a hospital, you need to have a 3 layers of security. Perimeter security at the infrastructure level. You need to have endpoint security. You need to have control in forms of your MDRs, DLPs, etc. And third is the developments that you are doing, that should be following the standard DevSecOps and static scans and all. Because if you look at it, the patient who is actually coming into the OPD is giving you data in form of your Aadhaar cards, in form of your Aadhaar card is I would say the major information that you give. And after that, the prescription which gets generated, there is always a threat of losing that information in form of a paper also. So that means a form of a paper as well as a form of the digital record which gets created. All of them needs to be secured. So therefore, I would say in last couple of years, the adoption of security as an overall practice, both on the cyber security side as well as an ingrained security practice, has been adopted by hospitals. It has become an integral part of your business. It becomes an integral part of the ecosystem. So you have to take it to the next level. And I think hospitals are adopting it in a very aggressive manner these days.
Okay, thanks for being very comprehensive. So we have completed one round with all the panelists. I'll come back to Praveen again. Now, again in the morning session, we heard a lot about predictive analysis for diseases and stuff. Keeping in mind, and what you said earlier, that how the implementation is happening, that is also. So what stage are we how realistically predictive analysis of diseases are happening, and what do you see the way forward?
Okay, yeah, very pertinent question, especially when we are talking about Gen AI space. In terms of our adoption and ensuring that they are able to do more predictive analysis. So I think the current models that we have are not necessarily fine-tuned or trained enough with Indian data sets. So I think that is the most important understanding we all need to have, that all these AI tools are great. Given a specific amount of data, what they have been trained upon, because how an Indian citizen or a person with South Asian characteristics would have a predictor when it comes to some of the biomarkers could be very, very different from a Caucasian, Western white male. So unless and until we factor that in, some of the models could go very wrong, and unfortunately some of the AI models that are used today don't necessarily explain you what was the reason or what was the logic that was used to come up with the prognosis for that reason. So that being said, it is like a black box today. You put some data and it will come up with the predictive analysis, but why it came up with that, it will never give you. So that was, again, I go back to the point where I was trying to say that we are, for that reason, trying to make it more like a my GPT, when I explained, was to use our own data sets with limited, so to speak, the domain, and making it more specialized for a specific specialty. So that way you don't, reduce the number of errors. You ensure that the chat GPT or any AI tool doesn't hallucinate. So reduce the errors, reduce the cost, and finally it improves the explainability, where they're able to mention that, okay, I came up with this reason or came up with this prognosis because of such and such, and it will point to a specific document or a specific page or a research paper from which it is able to come to that prediction. So in short, I guess using the biomarkers and understanding that if we limit the scope of these AI data sets, that will help us to be much more predictive in nature.
Okay. So, what basically, if I may sum up you are saying is the source of the data that needs to be authentic first before you apply all sort of analytics. Otherwise, the insights might not be so accurate also per se. Okay. Next, Prashant, I'll come to you with another relevant question. We are talking about a lot of these new technology adoption, which requires people with IT skill sets. Now, a function of a hospital, functioning of a hospital is different from both the employer and employee perspective. Why? First, why would a hospital hire a huge amount of IT people, if I may say, skilled? And why would an IT person, technology person, go and join a hospital for say? So that challenge, keeping in mind that challenge, how do hospitals look at having workforce with relevant IT skill sets?
Very good question. I think many of us must be struggling with the same issue, if I'm not wrong. See, honestly, in healthcare industry, there are many, partners available, and I'm sharing my own example, right? In healthcare vertical, there are many partners who are available, and the solutions are readily available and functional in various other hospitals, because this industry got evolved way back. I would say 25 years back. They started with billing automation, and then diagnostic became part of this. Now EHR, is quite prominent and functioning like anything. On top of that, we have added multiple layers, whether IoT or smart devices or wearable devices, home sample collection, various technologies are available. So the point is that since it got started way back, and in recent past, we have seen different sort of revolution of, healthcare products. You look at any area, talk about RTLS, readily available. Today, you want to track down the patient location, whether patient is in pre-operation theater or in theater or in post-surgical area. It's click of a button, right? And you are conveying such messages to patient attendants as well. Like your patient is not in OT now. He has already come out of OT. So such solutions are available. I believe it's not essential to hire hardcore technical people. Yes, infra part is definitely barred. You need not to touch infra part. In infra, you need network engineer. You need, in today's time, you need CISO as well. And you need a person who is going to support all your end users. You need somebody who can manage desktop as well. But as far as programmers are concerned, I would straight away say no. If you are not having really, a bulk of money, it's not advisable. Reason being, number one, you nurture the solution. It takes down the line 3 years, 4 years, and still not mature. So your partner keeps on investing some money on the product, and that's where it comes up as a solid, robust, scalable product. And with people like us, what happens, being CIO, I feel like your critical resources left. What's the solution? What would you do? Then you have to retain the manpower and so many ifs and buts. So it's a challenge, no doubt, because partner takes its own time in developing any new requirement. Number two, all the solutions are not coming with your hospital information system. You have to vouch on other people as well. But having said that, I think it's advisable from my end to, outsource it and retain people who are functionally expert. I repeat, retain people who are having healthcare mindset. In my, corporate office, they people are the most demanded people who can implement the solution, who can understand customer language, who can understand what clinician is demanding, what your top management demanding, what sort of reporting pattern is essential, what BA should deliver. So eventually my MD says straight away, you look into, patient concerns. How you can solve patient's 10 problem. Look into this. Then only IT is helpful for me. So that's where it's important to rely on functional experts rather hardcore technical people.
Okay. So what you are advocating is basically outsource and have functional expertise.
Yeah, I wouldn't say
Internal
completely
functional
outsource.
expertise
Yeah.
and outsource.
Yes.
Okay. So that interesting point. And next speaker, Dr. Shantanu, Dhar, I'll come to you with this point. When you are outsourcing, now we all know outsourcing is one big challenge. Just outsourcing is not enough. You have to manage the third-party solution provider. There are different kind of SLAs. We know other sectors also follow all these 5 nines, 99.9 and all this. Again, as I reiterate, healthcare, there is no scope for even 0.999. So, third-party solution providers, how do you ensure reliability? One. Two, escalating costs. Because ultimately for a third-party solution provider is ultimately there, he is doing business. So he is looking at hospital as a customer to earn profits. So these two challenges, and within that framework, how do you maintain relation, identify the right solution provider and maintain the relation?
Sure. So I think most importantly, we should be doing a couple of things here to manage the partner and make sure that the right for the right application, right set of people have been given to us, to the hospital sector. What we do in our sector, we have one of the big fours as one of our partners who has developed one of our healthcare app. So what we do is we have a very stringent ITSM process through which the entire ticketing tool and the ticketing the escalation matrix is managed. We have a change control board. We make sure that nothing goes to the production environment without the functional heads approvals. That becomes a very key important part over there that the change control board plays. Now the third part would be that with respect to from the application point of view or from the partner point of view, how do we manage that they don't escalate the cost? my CIO or our head always says this, and our CEO always says this, that we don't have to go to the moon. So the most important thing is the patient care that we have, and we may have to make sure that that is achieved. Now, for that, if the doctors, we have to give it minimum, we have to prioritize. Let's say what we do is we go ahead and we take out all the requests that we have. Let's say I have in a span of 1 month, I have 30 requests from all our functional heads and from the doctors. Then we go ahead and prioritize. We have a prioritization tool. We prioritize that which one has to be prioritized, top 1, 2, 3, a critical one, a high and medium one. And then we make sure that that goes to the production environment. So what happens is with that, over a period of 6 months, we have the effort estimate that is given by a partner is maintained. We don't make sure, we make sure that the things which are not or might not be required for that particular application or might not be for the patient care does not go into production. The ones which are prioritized by the doctors and which is absolutely for patient care goes into production and helps our doctors and the patient. So that's how we prioritize.
Okay.
Thank you.
Thanks. Thanks. We have 1.5 rounds, heard 1.5 round from all the hospital perspective. Since we are talking about solution providers, I'll come to you, Rupinder, now. One, you have heard.
So I thought you forgot me.
No.
And then I was thinking if AI is around, probably, it could have picked up that this guy is Bist,
I was deliberately trying to take a rejoinder from you on the solution provider perspective, the relation with hospitals and how do you see
Thank you
that?
for the opportunity. And I think world is changing very, very fast. And the way I see it is still there is a lot of chaos. When I visit hospitals, I come from doctor's family and I know, how the whole thing works. Doctors would like to have long queues, so many people waiting. But people sitting here probably on dash, we are not going to change the world. Those who are in 25, those who are in 20s, 30s, they are all about technology. So I can clearly see that, the whole thing is going to swipe the whole healthcare very fast. The way we have DigiYatra, I'm sure, it's going to be HospiYatra. Currently, apps are not talking to each other, but there is going to be something, moment you walk in, the patient walks in. Even before he walks in, everything is arranged through technology, through AI, through data. Lot of operation theaters, when I go today, even today, there is a list written, handwritten that, patient so-and-so, age so-and-so. It's also manual, I don't think it's going to work that way, probably not too much away in the future. The moment doctor comes in, the AI is going to talk about the vitals of the patient, what is wrong, what is right, is it operatable, or, all the parameters will be there. I see a lot of operation theaters across India, most of them, they are not internet enabled, if you have to bring in technology, like we have technology called as, CMS, where, lot of doctors can collaborate simultaneously when operation is running. And even for medical legal purposes or for training purposes, hundreds of doctors can simultaneously be trained. A senior doctor can sit at his home and he can say that don't go this side, he can make it on his screen, don't go here, this is now, so don't go this side, cut here. So, but a lot of OTs do not have even internet connected, a lot of hospitals, government hospitals I am talking about, and technology has to be something which should not be in the prime capital hospital chains, it should be all pervasive, all the small hospitals, tier 2, tier 3. So we are going to see humongous change, and this is the first phase, but there is a lot of disruption which is happening, and people who are adopting that disruption are really creating value. You must have seen, the companies who are at the forefront of technology, they are making hell lot of money. Reason, because they are adopting, they are way ahead of the curve. And similarly, the next generation, India is the youngest generation in the world. So they are going to change it. They are not going to sit and wait for insurance approval to come for 4 hours that आपका approval नहीं आया है. They will not even visit that hospital again. They will not go to that insurance agent in future. They want everything well structured.
Okay, thank you, and nicely putting that perspective on. Next, I'll come to Mohit Tandon. My question is: these digital tools we are talking about, how are the digital tools improving the patient outcomes? How do you see that happening?
See, that happens when all the devices, if we talk about the IoT devices, if all the IoT devices are continuously giving the data, so we can apply the GenAI and accordingly we'll give a very good output. But right now what's happening that the data is not coming continuously. So we have all the traditional modes of data on which GenAI doesn't work. The use cases for GenAI does not have are on those traditional data.
Okay, thanks. Himanshu, my question is, healthcare we know is a very highly regulated industry. There are a lot of compliances that you need to conform to. When we are talking about technology, and as Rupinder also mentioned, the young generation, the millennials, they are looking everything fast to happen. And when you are trying everything to be fast, you have to bypass some of the regulatory compliances, which otherwise right now is currently not possible. So how do you maintain a balance, and what do you see, more importantly, the way forward?
Well, first of all, I don't suggest to bypass any regulatory compliances. So that's not something which we should be doing for just sake of providing an additional minute to somebody. I can keep on talking about technology, AI and all that stuff. Having said that, the issue is that the most of the hospital are not even focusing on the bare minimums which they have. 90% of their equipments, biomedical equipments, are not connected with their systems. Okay? So there is, where we talk about data, we talk about seamless flow of data and all that stuff. That's not there at all with most of the hospitals. And there is definitive need on the OEM side also to work on these aspects. There are biomedical devices in the hospitals which don't have any capability to even exchange the data with other systems. So now this is also one of the parts of compliances, and you simply can't bypass, which means that you are writing all this stuff on paper, on Excel sheets, recording the data, and then submitting to the authorities, right? The very simple thing, if your system is, let's say your radiology devices, your modalities do not understand MPPS messages, then you are not able to record what is the actual utilization of your machines, what kind of, let's say, exposure you are given, you have given to your patients. For example, on a CT, you have to be very much sure that what kind of exposure you are giving to your patient, and your doctors are not repeating those tests again and again onto the same patient if you have done it. Rather, if somebody has undergone CT, and if it is a must, go something else, do some lower test, so that not to expose the patient. So yes, I do not suggest to bypass any regulatory compliances. There are ways and means to do comply to it, as well as to ensure that you are giving the best of the services. Pick one thing at a time and move forward with it, rather than doing everything together.
Okay, thank you. Nikhil, I'll ask you, and I'm sure you must have been facing this with your management also, and we heard in the morning from the management side, one of the panelists told that IT is the one segment where the budget increases maximum volume every year. And now when all these new technologies we are talking about, it's nice to implement them, but all of them come at a cost. Whatever economization the solution provider can do, but it still comes at a cost. and the hospital, it's not feasible for a hospital to end of the day. Hospital is also a business to absorb all the costs, so it's passed on to the customer. Now, keeping in mind that challenge, from an IT perspective, one, how do you keep the cost down? And two is importantly, how do you interact with the management on that challenge front?
I think this is an interesting question, and a difficult one to answer. So I think, if you look at it, obviously, IT is always looked as a cost center everywhere. Whatever industry you talk about, IT is always looked at as a cost center. But if you see specifically right now in healthcare, if you see IT has become an enabler. It has become a driving force for all of your patient care, service excellence, I would say your clinical protocols, your, all patient services, etc. is now driven by technology. Now, obviously technology comes with a cost, but there are many ways of maintaining it. If you look at it, the stuff which is standard, let's say stuff like your ERPs, etc., which are standard products which are used across the industries. I think those are the products which can still be be taken as off the shelf, and you can control your cost in a standard way that you do. Whereas the stuff which you are making your own, for example, stuff related to your queue management, stuff related to your kiosks, stuff related to your HIS interoperability. That is where you can have a mix and match of some of the in-house capabilities if you develop versus the products that you take from the market. Now, if you have that mix, you're able to manage your costs in a effective way. Because if you completely go on an outsourcing model, then your cost base actually becomes very high. Whereas if you completely go on an in-house model, then you're actually the cost sits in your books. So which is the salary cost. So I think the way we have been able to manage this in an effective way is it's a hybrid model that we have. Standardization of the products costs we are using to a larger extent. We are doing a lot of in-house development of the products which we know is going to be something which we are going to use for next 15 years or 20 years, creating our own IP. And when you invest in that, you actually over a period of time you amortize that cost. And that is where we have been able to strike out that balance, having it optimal. Obviously it is increasing, but it is increasing optimally. Another factor which is actually causing a spike in the hospital costs in recent last I would say 3 to 4 years is the information security related tools cost, which is actually making your capexes going very high.
Okay.
But you don't have any choice. If you have to secure, you have to have security in place for all your I would say assets. And that is where if you manage your development costs, you manage your ERP costs with a some justification to your capexes which is going on the security, I think it's still manageable.
Just an aside here, very interesting point. You mentioned about IT, not just healthcare, in every sector is treated as a cost center, which is true. Having said that, like your example, you mentioned you have created so many IPs. And rather than looking at just the amortization of the costs over a period, have you looked at, since you are a large hospital from that perspective, leveraging some of that IP to make the IT team a profit center? You need not hive off a separate IT company. That's the other extreme. But somehow solutions for healthcare.
No, I think we are on that path only. We are creating products which can be leveraged by other hospitals in the industry. We are actually making those kind of products. And maybe if things goes fine, we might be getting into a separate vertical as well.
Okay.
Because if you see the way industry is structured today, you'll see HIS as a core backbone is something which we do not see a single product across all hospital chains. And though healthcare has become an organized sector, but it is still unorganized to a larger extent.
True.
So that is where if you can try to run behind getting a standard product for specifically things like your lab information systems, your EMRs or your HIS, you'll end up having a mix and match of it. Then interoperability becomes an issue. Why don't you create your own and then leverage it over becoming a product and having it given to the market. So that's the thought that we have.
Okay, thanks. So the last round, I'll come and start with Rupinder in the last round. We look into a little bit of crystal ball gazing into the future.
Yeah.
In terms of technology being adopted by the hospitals, what sort of SOPs do you see evolving in terms of adoption of some of these technologies in the hospitals?
Yeah, so some of my co-panelists actually made a very relevant point. So one of it would be, to have everything talking to everything, all the instruments, data, hospital data, operation theater data, machine, then, security of the data, data analysis. Somebody in the morning was also talking about, that there will be AR, VR, or, so just wanted to share with you, there are companies in US now and elsewhere, where there is a medical kiosk. So the patient goes to the kiosk, but doctor is not there. Doctor may have given his feedback in the night by his comfort. So I think as an SOP, hospitals are also going to evolve that way anyway. And, the change agent will be, CIOs or, the IT guys sitting here, they know both sides, they know the hospital infrastructure and current SOPs. They will also know where they have to reach, if they have to stay competitive. So there will be a lot of changes which are on its way. And good thing is, in digital transformation, India has actually crossed several other countries globally. So a lot of my friends and youngsters, when they go to Europe now and they come back saying that, like my son said, that there is no Swiggy, there is no Blinkit, and so I think India was going to make that big leap, even in hospital industry. And in the morning somebody said that even medical tourism, we are going to be probably ahead of a lot of other countries. So SOPs exactly, I think they can define more than me. I can talk in terms of technology which is going to disrupt. For example, just one example before I close. So there are a lot of robots, which are being sold, and big 5-arm robots, Da Vinci or somebody, difficult to maneuver, very, very costly. You need to give a lot of training. But we are working on surgery specific robots, which will be very, very precise, very fast, small, and they can do n number of surgeries very fast. For example, we are working on TURP or a robot which does gynae procedure, it will cost say 2 crores. And it will be very small, very easy to handle, and much more sharper in terms of execution. Thank you.
Okay, thank you. So Praveen, now 1 minute to each of you. The future.
I think future will be prescriptive, preventive, and personalized in terms of, having the
three
data and then
Ps.
use it. Yeah, I can add more P's to it. I can make, but yeah, I think, those would be my take on it.
Okay, and thank you. Prashant.
I think whether it's predictive, prescriptive, or whatever, AI is gonna be there in next generation. There is no doubt, and definitely Gen AI gonna play a vital role, especially with metaverse and all. In healthcare industry specifically, wearable devices are going to boom. There is no doubt at all. I have seen significant surge in the growth of wearable devices, and the market is really flooding with all such devices, and due to interoperability element, people are linking all these devices with your hospital information system, HIS. Now we can provide support to geriatric patients. So definitely AI, wearable devices.
Okay, thank you. Shantanu.
So I think it's going to be remote monitoring of the patient, clinical decision support, and along with that, predictive analysis, as everybody said. So these are the three main things that I see that's coming up in the long run for all of us. Remote monitoring is because majority of our healthcare is still in the tier 2, tier 3 cities. Clinical decision support is that because we're talking all about data. So from that data, how well we can data mine, take out the actual data and then give the doctors to decide. And then from that, the predictive analysis can be taken into consideration.
Thanks. Mohit.
The first one would be AI, followed by the strong cybersecurity softwares with AI that will help.
Okay. Thank you. AI and cybersecurity. Himanshu.
I would rather talk about the reason, what would drive the growth in technology. While we are a young nation, but we have started to age. And as people are aging, and with 140 crores of overall population, the aging is going to hit us. So the remote monitoring which you are talking about, the preventive healthcare, this is something which is going to drive, apart from GenAI, the technology drives, and predominantly it would be on penetration of telehealth in the rural areas. Obviously, it requires a lot of infrastructure, which to be supported by the government and the private players in terms of connectivity and all. Bringing down the costs of the solutions, whether it's on the cloud or whether it's COTS or whatever it is, and the support from the government organization and the regulations. This is something which is going to drive it further.
Interesting. Nikhil. The last word with
Yeah, so I think one would be automation, because specifically hospital industry, a lot of functions which are manual. Automation is a keyword which needs to be brought into the operations. Second, IoT and IoT and RPA is one thing which again goes back to the operational efficiency and patient care, in terms of the services. Third, I would say obviously data-driven analytics and use of GenAI for patient longitudinal journey to give more of a clinical decision support to the doctors to do quick prescription, quick analysis, and quick I would say diagnosis for the patients, because rather than looking at tens of papers and or records in the system, a clinical longitudinal journey, concise, precise, and more towards predictive, that is where it will ease burden from the doctor's fraternity, because that is the most important fraternity which is actually getting overburdened with the amount of population and amount of the diseases and the number of patients which are coming into the hospitals. So I think these are the things which will be the future.
Great. Thanks. With that, we come to an end of this panel discussion. And before we disperse, I would request Sanghamitra Mohanty to come and hand over a token of appreciation to all our panelists. Starting with Praveen Bist. Prashant, Vashisht. Shantanu, Himanshu, Bhardwaj. Nikhil, Goel. Rupinder, Singh.